The question arises, can you starve cancer with nutritional modification? The short answer is no, you cannot do that. Cancer will find a way to nourish itself even if you don't eat any food. Now, the bigger question is, how does nutrition affect your immune system? And are there things you can do nutritionally that will make your body inhospitable toward cancer, specifically toward prostate cancer, or really cancer in general? Now, this notion of starving cancer is very popular and very appealing. I get it. Cancer loves to live on sugar. Therefore, if you don't eat sugar, the cancer can't thrive. The problem is your body lives on sugar. Your brain needs it. And even if you never eat sugar, the liver will make it. Now, there's a rational basis for modifying simple carbohydrate and junk food. But the point is not to take it to an extreme and go through fasting and go through juicing. There's so much misinformation. But this is the caveat. What a person believes in has power. And although there's little to no science supporting juicing and supporting intermittent fasting regarding cancer outcomes, it's not to say that an individual can't benefit if they truly believe that's going to help them. But my message is really one of living abundantly. I'm not going to put myself, nor will I suggest that you go through any kind of hardship or misery unless it has clear, distinct benefit. So let's come back to the whole nutrition thing. Although I do not advocate fasting because I don't believe it has any value in any realm of human health. Intermittent fasting, yeah, I do that. You know what I call it? Sleeping. It's a natural pattern. We have to eat frequently because we have a big brain and a little stomach, and the brain burns energy. And stress to the human body is not a good thing to do. And stress comes from nutritional deprivation. The idea that you can somehow improve your health through this fasting pattern, I think, is kind of silly. But if you enjoy fasting, that's a different thing. Some people will tell me they have better mental clarity. They feel less bloated. They feel better, right? I'm not going to dispute that. I'm talking about you out there who's like loathing the notion, but doing it because you think you'll live longer, right? Scratch that idea. Here's one thing for sure. Stress is cancer's elixir. Cancer thrives in a stressed environment because your immune system dips. And what can stress you? Worry? What can stress you? Misery? So I had a patient once, he was stage 4 cancer and metastatic lung cancer, a very difficult position to be in. And he had read something that advocated organic juicing, like 5 times a day. He said, "Doc, I'm spending my whole day finding enough organic vegetables to make juice out of it." But, right? It was stressing him. Not good. So if you like to fast for spiritual or for mental health or for personal reasons, then have at it. But the question for the rest of us is, where should the focus be? Should I fast? Should I be a vegetarian? Should I eat organic? Well, the most important variable that overwhelms every other aspect is your percent of body fat. The fat on your body contributes to cancer risk. That's irrefutable. The evidence is powerful. Not only prostate, but every other cancer. So when you're fighting cancer, do not think of starving it in a manner that alters the way you might eat, other than eating in a manner to shrink fat. I'll give you some tips on that. You can take this to the bank. I've been doing weight loss medicine for 30 years. When I was in the Army, I was in charge of the Fat Boy Clinic. That's what they called it. When the soldiers would come to me, and I would have to evaluate them metabolically, which meant squeeze their thyroid gland, little blood work, and if they can't lose weight, then they're drilled out of the Army. What a stupid idea. These husky, strong, vigorous soldiers, all because they carried extra weight. That's when I began to realize this is not a function of intellect or willpower and metabolic dynamics within. So here are the principles you need to follow if you want to shrink fat. You cannot eat just because of hunger. Hunger is a simple stimulus from the primitive brain to the frontal lobe, telling your body that it wants something. It's bored. It wants sex. It wants entertainment. It wants stress reduction. All come to the frontal lobe, the intellectual part of your brain, as hunger. It does not mean that you need fuel for the machine. Number two, there's no off button. When you start to eat, you do not eat until you get full. Hey, there's a hole at the top and a hole at the bottom. You're not filling anything, folks. You get temporarily uncomfortable. So you can't trust your sensation to guide volume of food, and you can't trust your sense of hunger, and you must eat at times when you're not hungry to prevent rebound hunger, to prevent rebound fat accumulation. So here's how that works. There's a hormone called ghrelin that's in your stomach, and it communicates with your brain. It tells the brain, right, how much food is down there. If there's no food down there, the amount of ghrelin increases. Now here you are at work, you're busy, you're thinking, you're doing stuff. Your frontal lobe is on fire, the ghrelin level goes up, but you don't register the sensation because the frontal lobe blocks it. Then you get home. You haven't eaten maybe since breakfast. You've been too busy. You walk through the door and wham, it hits you like a tidal wave, starvation. That ghrelin level is screaming. So you eat something. Problem, hunger doesn't go away. There's a 30-minute lag between what you eat and how it registers in the brain neurochemically. So we got a problem because the remedy for your hunger is not to eat more. It is to eat consistently. Look, a prize thoroughbred is not fed when it appears to be stressed and hungry. It is fed on a schedule. Most of you who have pets feed on a schedule. If you fed your dog around the clock, it would get fat. It would eat the food you offer it. We're unfortunate in that we can reach the refrigerator, the cabinet. We can feed ourselves whenever we want. So pick a feeding time, at least 3 per day, right? I've never seen anybody in my practice consistently lose fat and gain muscle when they're eating less than 3 times a day. Losing weight is not the goal, folks. It's losing fat, percent body fat. If you can get to a body analyzer, that's great. At least 3 times a day, protein-centric. Now, I've also heard people talk about meat. Doc, I'm going to go vegetarian. I'm going to go vegan because meat is evil. It's nonsense. What happens in these dietary extremes is they take a detail, chemical or nutritional detail, and blow it up to a whole story. So in meat, there is an amino acid called methionine. It's an essential amino acid for human health. In excess, methionine has a potential to be an accelerant to cancer cells because cancer cells like methionine, just like your cells. So the art of the game, folks, is to make it difficult for cancer to thrive by shrinking your fat in a manner that sustains your own health and immune function, and in a manner that holds on to your muscle mass, which is super critical. 3 feeding times or more per day. There's no such thing as a healthy snack. That's an oxymoron. If you want to shrink fat, you must not eat except for predetermined feeding times that you will establish, and you'll eat by the clock. Healthy snack, no such thing. Well, what about this idea that you should eat antioxidant foods with polyphenols and blueberries and these good foods? Foods are not good or bad, right? They're like a force of nature. They're like water, like rain. Is it good or bad? It depends on volume, on timing, correct? So the same thing that is an antioxidant at volume X can be pro-oxidative at volume 3X. Goes like this. When you eat, you must create inflammation to digest the food, 100%. When you eat, you instigate mTOR, which is a natural occurring product the body makes to help accelerate cellular digestion and proliferation. If you eat a lot, you create a lot of inflammation and a lot of mTOR. Neither of those things are good when you're fighting cancer. Shoot, neither of those things are good in general. But we've been bred in America to believe that a portion is double size. I went out to a restaurant the other night. The steak on the menu was 12 ounces. 12 ounces. That's like 3 meals, folks. A 4-ounce steak, that's about 30 grams of protein. So knowing that, I always cut my entrees in half when I go to a restaurant. A little bit frugal. I like getting 2 meals for one price, or I'll split them with my wife. I advise you to follow this pathway. Shrink the fat. Don't stress about fasting. Don't stress about avoiding any particular food category. I'm talking food, not junk, right? How about artificial sweeteners? They've not been shown to help you lose weight. I recommend against them. Now, sometimes an artificial sweetener may be a component of a protein shake or some other type of meal replacement. In small amounts, probably tolerable. Should you fast intermittently? You can, but you don't have to. Should you be vegetarian? You can, but you don't have to. Stress is the key ingredient, right? To live life abundantly means also living life with joy, with hedonism. Can you drink alcohol? Alcohol is a poison. Isn't it bad? If it gives you pleasure, now I'm not talking about getting drunk pleasure. I'm talking about a cocktail in the evening, a glass of wine with dinner, an occasional can of beer. It's not going to inflame your cancer. When you enjoy yourself, when you're happy, when you're having pleasure, this is critical to your immune function. It's not really optional. I hate to be corny, but the old laughter is the best medicine. Some truth to that. So living harmoniously, living joyfully, your day should not be walked underneath a shadow of cancer fear. Oh my goodness, if I have a glass of wine, my cancer is going to blow up. Oh my goodness, if I have an occasional croissant, I'm going to ignite a flame of malignancy. Neither are true. It's more the habitual pattern. It's more that percent body fat. Can't get around it. It is a powerful determinant. So make that your priority. Don't worry about starving cancer. Now, there are some things that are really worth adding into your eating pattern. I do not advocate juicing. Not at all. When you juice, you concentrate sugar. When you juice, you destroy fiber. When you juice, you enhance the volume of sugar over what you would have by virtue of eating the vegetables themselves. If you like juice, make it recreational, but do not think it has intrinsic health benefit, because it doesn't. A glass of orange juice has as much sugar as a can of Coca-Cola and is fattening. Now, if you are lean to begin with, or if you just love orange juice, I suppose you could have a little. Not going to harm you. Volume is the key. So when it comes to foods that are worth eating, prostate cancer does not like tomatoes. Lycopene, the ingredient, one of the components of tomatoes, has been shown to have activity against prostate cancer. I recommend that you have 3 servings of tomatoes every week. By the way, that's probably far superior than any lycopene supplement you can get, because there are other things in that tomato that may have value. The more dark, the redder, the deeper the tomato, the more lycopene. So a plum tomato, cherry tomato, really high in lycopene. Now, can you have it more than 3 times a week? Yes, no harm in that. But 3 times a week is what I'd recommend. Broccoli, cruciferous vegetables, fabulous. Half a cup 3 times a week, unless you hate broccoli. Remember the joy principle, folks. That's real. If you choke down broccoli because you think it's good for you, it's probably going to do you harm because of the stress of choking it down. Tomato, broccoli, green tea. Can't go wrong unless, again, you hate it. But green tea, 3 servings a day, has elements in it, e.g., CG, catechins, and other elements that have been shown to be supportive of immune function. It correlates with lower blood pressure, lower cholesterol. It correlates with weight reduction. So green tea is fantastic. 3 times a day, have at it. How about olive oil? Put that in the good column. Olive oil has got some antioxidant polyphenols, so it's a nice oil to use. Look, when you're in doubt about which oil to use, you can't go wrong with olive oil, unless you hate it. But it's, as far as a nutrition source, as far as a safety parameter, it's a number 1. Are the seed oils bad for you? It's uncertain, right? They may be. I don't think they're the worst thing on the planet, but I do know that olive oil is irrefutably meritorious. Coconut oil is right up there as well. So you can use those pretty confidently. How about fish? Salmon in particular, fatty fish, been shown to have some merit. Interesting to me was the research I did comparing farmed salmon to wild caught. Now, farmed salmon is controversial environmentally. I get that. I'm strictly talking about its nutritional content. A university in Canada looked at farmed versus wild caught, and they found there was no difference in the nutritional makeup. They also found that the wild caught salmon had as much, if not a little more, toxins in it than the farm caught. Now, if you're against farmed salmon for environmental purposes, socioeconomic purposes, I'm on board. However, the price differential, yikes. Wild-caught salmon is a fortune. So for my money, I eat salmon that is most likely farmed because I get it at restaurants. So don't fret, people. Don't worry about starving cancer by doing nutritional gymnastics to try to avoid things that are going to blow it up. It's not that much of a consequential variable that you can't enjoy yourself. But do pursue durable nutritional change to shrink fat. Do not go on crash diets. They always fail. 100% rebound. Whatever you do in your nutritional modification should be the way you're going to live going forward. Nutritional incrementalism. You establish a plan on one day of the week. How many feeding times? I recommend you start with 4. And I recommend the first one happen within an hour of getting up. And a meal in this world does not need to be a plate full of varied foods. It can be literally a protein shake. It can be a 4-ounce serving of steak or chicken. It does not need to be a meal. Variety is not essential to your nutritional health. Volume is the key element, and consistency. And if you can pull that off, you're going to do okay. I'm looking at the clock because my next feeding time is in about another hour or 2. I'm very methodical, and I encourage you to pursue that as well. So enjoy your food. Enjoy socialization. On occasion, enjoy a dessert even, but don't make it a habit. If you choose to drink adult beverages or alcohol, enjoy them, but volume control. Maybe an ounce, no more than 2 per serving. You're in charge of that. But don't be fearful of eating meat, and don't feel obliged to be vegetarian or to do fasting. You can do this healthfully. Foods to add, I mentioned a few. One to consider, garlic. So garlic is an immunologic support. Problem I have is kind of smells bad. And I guess that goes to the stress piece. Then you read about things like bitter leaf. There are some things that are just not practical to acquire, and therefore I don't factor them into the equation. Can you get turmeric into your diet? Might that help? It might. It's got antioxidative quality, but I don't know too many turmeric recipes, and I'm not going to go buy it and sprinkle it on my food. So you get some choices, gang. Live life joyfully. Choose your thought. Choose how you're going to eat. Establish feeding times. Get a food scale. Measure volume. My recommendation is the protein portion, the meat portion, be not greater than 4 ounces, maybe 5 if you're a big person. I know it's not much, but that's the volume that will correlate with your best health. The most dangerous food to eat is too much. The best thing you could do with food is to reduce portion size, but not eliminate food altogether, not do it via fasting. The American plate has become gargantuan. You don't need to eat that way. You're fighting a different battle now, right? What you used to do yesterday, you don't quite get away with today, not with clear conscience. Whatever happens next, you know you want to play your best card when it comes to nutrition, physical activity, when it comes to, obviously you're not going to smoke. Alcohol, we talked about. Modesty is okay. We'll talk about other elements, supplements, repurposed drugs. You put it all together, you're creating an environment that is very inhospitable toward cancer of the prostate and cancer in general. When They tracked men who had prostate cancer, over 200 of them. They followed them unto their death. Over 200 men who had diagnosed prostate cancer died. Only about 25 of them died from metastatic prostate cancer. The rest, heart disease was number one. Other forms of cancer were number two. So this environment you're creating, it's got benefit to you beyond prostate cancer. The common denominator, it will help with all cancers and heart disease. So you get to live your most vital life. We're here, folks. We're here to have a good time. We're here to enjoy life. We're not here to be miserable. And if doing something makes you miserable, it's likely amplifying your risk of cancer progressing. So eat smart, eat happy, embrace hedonism. And if you choose to do something because you like it, I'll never object to that. Even if it is fasting, even if it is vegan dieting, no objection, but it has to do with how you want to live. That's where we draw the line. All right, team, until next time, thanks for spending time with me.